Welcome to Luck Scout Psychology. Have you ever felt an overwhelming urge to disappear at a party? Many people experience social anxiety from time to time. This is the reality for millions living with avoidant personality disorder, or AvPD. Avoidant personality disorder is characterized by social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. This fear can be so intense that it leads to avoidance of social situations altogether. They may long for close relationships but avoid them out of fear of being hurt or rejected. Understanding AvPD is crucial for recognizing its presence in ourselves or others. Imagine being invited to a friend's birthday party but feeling paralyzed by the thought of social interaction. The anxiety becomes so intense that you end up making an excuse, choosing to stay home alone. Social situations can trigger intense fear and anxiety, leading to avoidance behaviors. This avoidance prevents individuals with AvPD from experiencing genuine connection. They may avoid pursuing new job opportunities, fearing potential criticism. At the heart of AvPD lies a deep-seated feeling of inadequacy. Individuals with this disorder often view themselves through a distorted lens, magnifying their flaws. These negative self-beliefs fuel their social anxiety and contribute to their pattern of avoidance. Every interaction becomes an opportunity for self-criticism, reinforcing the belief that they are fundamentally flawed. It's important to remember that these feelings of inadequacy are not based in reality, but are a symptom of the disorder. While individuals with AvPD might appear withdrawn, they often crave connection and belonging. They long for intimacy, friendships, and a sense of community, but their fear of rejection becomes an insurmountable barrier. This internal struggle can lead to feelings of loneliness, shame, and isolation. Avoidant personality disorder is a complex interplay of genetic predispositions, early childhood experiences, and individual temperament. Researchers believe that genes may play a role in shaping our temperament and influencing our vulnerability to anxiety and social inhibition. Environmental factors, especially during childhood, are crucial in shaping our sense of self and our beliefs about relationships. Experiences of early rejection, neglect, or criticism from caregivers can be particularly impactful. Imagine a child who is bullied relentlessly at school for their quiet nature or their appearance. This constant exposure to rejection and humiliation can lead to a deep-seated fear of social situations. Even subtle forms of rejection or neglect can have a profound impact. Early attachment experiences also play a crucial role. While early experiences are influential, not everyone who experiences adversity develops AvPD. Research suggests that some individuals may be genetically predisposed to anxiety and social inhibition. These temperamental differences can influence how we perceive and respond to social cues. Understanding the interplay between genetics, temperament, and environment is crucial for developing personalized treatment approaches for AvPD. The path to understanding and addressing avoidant personality disorder often begins with recognizing its presence. Recognizing the signs within oneself can be a mixed bag of emotions, relief at finally putting a name to the persistent discomfort. If you resonate with these experiences, seeking guidance from a qualified mental health professional is essential for accurate diagnosis and personalized support. Diagnosing AvPD involves a multifaceted approach, going beyond simply checking off symptoms on a list. A trained mental health professional uses their expertise to piece together a comprehensive understanding of the individual's experiences. The process often begins with a thorough clinical interview where the therapist asks detailed questions about the individual's social interactions, relationships, work life, and emotional well-being. Building a trusting and collaborative relationship with the therapist is paramount throughout this process. While avoidant personality disorder shares common ground with other mental health conditions, understanding the nuances that set them apart is crucial. SAD often manifests as intense anxiety in specific social situations, like public speaking. AvPD represents a more pervasive pattern of avoidance that extends beyond specific situations. Differentiating AvPD from other personality disorders, such as schizoid personality disorder, is equally important. Embarking on the journey of healing from avoidant personality disorder is a deeply personal and often challenging endeavor. It requires courage, self-compassion, and a willingness to confront deeply ingrained fears and beliefs. The good news is that with the right support and therapeutic interventions, individuals with AvPD can experience significant improvements in their quality of life, fostering deeper connections and living more authentically. Treatment for AvPD typically involves a multifaceted approach, tailored to the individual's unique needs and circumstances. There is no one-size-fits-all solution, and the journey might involve exploring various therapeutic modalities, medications, or a combination of both. The key is to find what works best for the individual, empowering them to navigate social situations with greater ease and build a life filled with meaningful connections. Psychotherapy, particularly cognitive behavioral therapy or CBT, forms the cornerstone of AvPD treatment. CBT helps individuals identify and challenge negative thought patterns and beliefs that contribute to their avoidance behaviors. It equips them with practical skills to manage anxiety, improve social interactions, and gradually confront feared situations. Medications, such as antidepressants or anti-anxiety medications, might be considered in some cases to manage co-occurring symptoms of depression or anxiety, creating a more stable foundation for engaging in therapy. It's important to note that medications alone cannot cure AvPD, but they can provide relief from overwhelming emotions, making it easier to address the underlying psychological factors contributing to the disorder. Imagine a garden overgrown with weeds, representing the negative thought patterns and beliefs that often fuel AvPD. Psychotherapy, particularly CBT, acts like a skilled gardener, helping individuals identify, challenge, and eventually uproot these weeds, making space for healthier, more adaptive ways of thinking and behaving. One of the core principles of CBT is the interconnectedness of thoughts, feelings, and behaviors. For example, an individual with AvPD might have the thought, "I'm going to make a fool of myself if I go to that party," which triggers feelings of anxiety and dread, leading to the behavior of avoiding the party altogether. This avoidance, while providing temporary relief from discomfort, reinforces the negative thought pattern, perpetuating the cycle. CBT helps individuals break this cycle by challenging the validity of these negative thoughts. Are there alternative explanations or perspectives they might be overlooking? What evidence supports or contradicts their beliefs? Through a process of guided discovery, individuals learn to identify and challenge their negative thought patterns, replacing them with more balanced and realistic ones. Beyond cognitive restructuring, CBT also focuses on behavioral activation, gradually exposing individuals to feared situations in a safe and controlled environment. This might involve starting with small steps, such as making eye contact with a cashier or striking up a conversation with a neighbor, gradually working towards more challenging situations, such as attending social gatherings or job interviews. Medications can manage co-occurring symptoms and enhance therapy. Imagine learning a new skill while overwhelmed by anxiety. Medications alleviate distressing emotions, aiding therapy. SSRIs manage anxiety and depression in AvPD. SSRIs increase serotonin, regulating mood and behavior. Antidepressants take weeks to be effective. Discuss side effects with a medical professional. Benzodiazepines provide short-term relief for severe anxiety. They enhance GABA's calming effect on the brain, not recommended long-term due to dependence risks. Medication decisions should involve a thorough assessment. Professionals determine the best medication and dosage. Medications should be used with therapy for best results. They provide relief, aiding transformative therapy. Imagine a shy seedling, hesitant to emerge from the earth, fearing the harshness of the sun and the unknown world above. With gentle nurturing, consistent care, and the right environment, that seedling can blossom into a strong, resilient plant, capable of weathering storms and reaching for the sky. Similarly, individuals with avoidant personality disorder, while grappling with deep-seated fears and insecurities, possess an innate capacity for growth, connection, and wholeness. The journey of healing from AvPD is not about erasing one's true nature or becoming someone they're not. It's about cultivating self-compassion, challenging limiting beliefs, and gradually stepping outside of their comfort zone, one courageous step at a time. It's about recognizing that vulnerability, while often perceived as weakness, is actually the birthplace of courage, connection, and authentic living. Therapy provides a safe and supportive space to embark on this transformative journey. Through the guidance of a skilled therapist, individuals with AvPD can begin to untangle the complex web of thoughts, feelings, and behaviors that contribute to their avoidance patterns. They can learn to identify and challenge negative self-talk, replacing it with more balanced and self-affirming beliefs. Imagine learning to talk to yourself with the same kindness and understanding you would offer a dear friend. This shift in perspective from self-criticism to self-compassion can be profoundly liberating, paving the way for greater self-acceptance and a willingness to embrace vulnerability in relationships. It's about recognizing that perfection is an illusion, and that true connection blossoms in the fertile ground of imperfection. While individual growth and therapeutic interventions are paramount, creating a more compassionate and understanding society is equally crucial in supporting those with avoidant personality disorder. Imagine a world where mental health is treated with the same openness and acceptance as physical health, where seeking help is seen as a sign of strength, not weakness. Often, individuals with AvPD face stigma and misconceptions, their struggles dismissed as mere shyness or introversion. These misunderstandings can lead to feelings of isolation, shame, and a reluctance to seek help, further perpetuating the cycle of avoidance. By educating ourselves about AvPD, we can challenge these harmful stereotypes and foster a more empathetic and inclusive society. We can start by listening with open hearts to the experiences of those living with this disorder, recognizing that their struggles are real, valid, and deserving of compassion and support. Imagine a world where instead of labeling someone as antisocial or weird for their quiet nature, we approach them with curiosity and a genuine desire to understand their experience. Small acts of kindness, such as offering a warm smile, engaging in active listening, or simply being patient with someone who might struggle in social situations, can make a world of difference. Creating supportive environments, both in our personal lives and within our communities, is essential. This might involve promoting mental health awareness in schools, workplaces, and social settings, ensuring that individuals with AvPD feel safe, respected, and supported in seeking the help they deserve. If you resonate with the experiences described in this essay and recognize yourself or someone you love in the struggles of avoidant personality disorder, please know that you are not alone. There is hope, and healing is possible. Reaching out for help is not a sign of weakness, but a testament to your strength and your desire to live a more fulfilling life. Remember that you are not defined by this disorder. You are a unique and valuable individual with your own strengths, passions, and dreams. AvPD might present challenges, but it doesn't have to dictate the course of your life. With the right support, you can challenge limiting beliefs, cultivate self-compassion, and step into a brighter future, one courageous step at a time. If you're ready to embark on this journey, reach out to a qualified mental health professional. They can provide a safe and non-judgmental space to explore your experiences, develop personalized coping strategies, and guide you towards a life filled with greater connection, purpose, and joy. Remember, recovery is not a linear path. There will be ups and downs, moments of progress, and setbacks along the way. Be kind to yourself. Celebrate your victories, and learn from your challenges. The journey might be challenging, but the rewards of embracing vulnerability, connection, and authentic living are immeasurable. You are worthy of love, belonging, and a life filled with meaning and purpose. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.